Good evening, everyone. I hope I am clearly audible and visible to you all. Welcome you all to the FSTN Exploration Foundation presence. Yes, I am clearly audible to you all and clearly visible to you all. Welcome you all to the FSTN Exploration Foundation presence 3 days intensive workshop on advanced training program on critical care nutrition and management. So it is going to be held by FSTN Exploration Foundation under Skill India Mission, and the certificates will be given by FSTN as well as the Skill India. So welcome you all to this 3 days intensive workshop, and I hope you will able to learn something new. And on the last day we will talk about FSTN, we will talk about something about FSTN, some new ventures about FSTN, and along with that um, we will also talk about the various awardees. So you have already seen the award nominations are open. So on the last day after your session will be over, there will be that award presentation, and about FSTN we will have some session. We will have some talk about FSTN. So those who don't know me, for them I just want to introduce myself. This is Ms. Ishani Ganguly, Academic Coordinator and Faculty Head of FSTN Exploration Foundation. I, behalf of FSTN, welcome you all to the FSTN family. So hope you are aware of us, and let's start. I would request everyone, please mute your mic. I would request everyone, Balachandran Rao, I would request everyone to please mute your mic because it will be very difficult to conduct the session if your mic is on. I would request everyone to please mute your mic because it will be very difficult to take the session whenever your mic is on. So I would request everyone during the session also, please keep an eye on your microphone, on your video, because the session is being recorded. After your class will be over, within 24 hours you will get the recorded session, and that is an YouTube recorded session, so it will be uploaded for the live. It is not like that you have to be always like you have to take the screenshot or you have to take the notes. Please, whatever I am saying in the class, please listen to that. In the session, whatever I am saying, listen to that, because you will get the recording, you will get the PPT after the class will be over. You will get the PPT then and then, and you will get the recording of the class within 24 hours. So the first session will be conducted by me, the faculty head of FSTN Exploration Foundation. The second session will be conducted by Rhea ma'am. So ma'am is the faculty of FSTN Exploration Foundation, and the third class will be taken by Shudrika ma'am. She is also the faculty of FSTN Exploration Foundation. Okay, so we hope that you will all like our classes, and after a eighth the class will be over, there will be an award ceremony, and after that there will be some talk about FSTN, what are the future ventures. So I hope those who have joined new, they are able to understand my word. So without wasting much time, I am going to start my presentation. So it will be 35 to 40 minutes of presentation. After that, the discussion will be open for you all. So whatever the questions you may have, you can write it down. You can ask in the chat box as well. So you can write your question in the chat box, in the message box, what is present in the Google Meet. And also you can write up your question by your own. After our session will be over, we will have a one-to-one discussion session. The discussion session will be open. There you can unmute your mic and you can ask your questions. So without wasting much time, I am going to present my screen now. So, welcome you all to the FSTN Exploration Foundation presents 3 days online workshop on advanced training program on critical care nutrition and management. So, this session will be started from 6 March to 8 March, and every time the class will be from 7 to 8 p.m. Within 8 p.m. all your discussion session and all will be covered, and it is under Skill India Mission, and you will call, you get your certificates within, after the session will be over of 8 March. So, you will get your certification within a week. So today my topic of discussion will be the metabolic response to trauma, injury and sepsis, and along with that we will have a discussion session how to evaluate the nutritional status when a patient is admitted in the ICU. So critical care mean what we talk about intensive care unit or intensive trauma unit. That means ITU and ICU. majorly when the patient is being admitted due to any trauma, like it can be burn situation, due to a severe injury or inflammation situation, or there is too much of infectional stress or sepsis situation. So this metabolic response to trauma, injury and sepsis, when the person is suffering from this trauma, when the person is suffering from the injury, or when the person is suffering from the sepsis situation, what are the metabolic alterations happen to the body, and why their dietitian is very much required, why the nutritional needs matter during the ICU, and why the ICU dietitians are much more responsible for the people rather than the normal clinical dietitian. That's today I will discuss, and of course I will discuss about the metabolic responses, which is related to physiology and biochemistry as well. So I will let you know that during the trauma, injury or sepsis, what are the metabolic alterations happen, what are the alterations happen in carbohydrate metabolism, protein metabolism, lipid metabolism. So generally in our body, carbohydrate, protein, fat metabolism is been happening every time, every second, every moment, and it is producing as the energy through which I am doing my functions. But whenever I am suffering from any severe burn situation, or severe injury or inflammation is there, or a severe deep cut, or there is any type of sepsis situation all over the body, what are the metabolic alterations and how this process is going on, we are able to discuss today. And when a person is being admitted to an ICU or hospital, majorly this time the patient are at a coma stage, or the patient are at a non-responsive stage. So during that time, it is not possible to take the anthropometric measurement or ABCD method to be done. It is not possible. So how the nutritional evaluation can be done for those patients? How we are able to evaluate that yes, this patient is a nutritionally adequate, or no, this patient is nutritionally not adequate? How we are able to calculate the MUST score? Okay, so this is a tool to calculate the MUST score, M-U-S-T, MUST score. Today I will let you know what is MUST score, how in an ICU we are able to calculate the MUST score to evaluate the nutritional status of a critically care admitted patient. So let's start our today's session. So injury, whenever an injury happens to your body or any inflammation happens to your body, it leads to a lot of systemic effects to all over your body. First and foremost, hormones, the endocrine system, the autonomic nervous system, and the cytokines. All these produce a series of responses that are designed to help defend the body against the insult of trauma and promote the healing. So for whenever you are undergoing in trauma situation, so your endocrine system, your autonomic nervous system, cytokine, all are producing a lot of series of responses that are basically designed properly to help to defend the body, so that we are able to cope up with the trauma, we are able to cope up with the trauma situation, and the healing can be well revealed, or the healing can be promoted, so we are getting better tolerated, or we are become well, we are going to have a well-being and profound. So classically these responses have been described as the stress response. So this stress response means whenever your body is under stress, my body is developing some of the responses, or some of the metabolic responses, some of the changes my body is doing to cope up with that stress, and that is considered as stress response. And this term is coined by Scottish chemist Cuthbertson in 1932, the stress response term, which is a very important mechanism to cope up with the stress and to have a healthy well-being. So now this cascade of interaction and the host response in a severely traumatized patient, if I talk about a 40% burn patient, that is being followed in a recognizable pattern. Now the thing is that the how much it is going to have a depth, what is the duration of the changes, these are variable, these are depending on the extent of the injury, these are the presence of ongoing stimulation. So everything result in a marked variation in the metabolic response. So there is a changes in the metabolic alterations, carbohydrate, protein, fat metabolic alterations is there, and this variability persists during the later chronic and recovery phase of the original injury. So first and foremost, whenever a person suddenly is having some of the injury, some of the trauma, some of the sepsis situation, my first body's response to insult as directed and maintaining adequate substrate delivery to vital organ, majorly that organ where there is sepsis, that organ where there is injury or inflammation, there my body deliver a abundant amount of oxygen and energy, and in that way just shut off or just insult or just stop the process of sepsis or injury or trauma, and in that way stop or inhibit the mechanism and improvement of the body's healing process is started. So what are the physiological response to trauma? So the metabolic response to trauma in the human is there is three phases. First phase, if I talk about, there is F phase or decreased metabolic rate. So first, what happened whenever a person has directly come to the hospital, there is severe trauma or injury situation or a sepsis situation. During that time, the first and foremost thing what we can see in a patient, that is metabolic rate is severely decreased. Carbohydrate, protein, fat, all metabolism is decreased, and that phase is considered as F phase. That is the early shock phase when the body is also shocked and body is not able to take that trauma. Now there is when the catabolism is increases, so that is called catabolic phase, or that is the second phase when my body is able to cope up with that trauma and already giving the stress responses. That is a phase which is known as flow phase or catabolic phase, when the metabolism start to increase. And last but not the least, when my body is started to have a healing recovery starts, that phase is considered as an anabolic phase. So first we start with F phase. What is F phase? It is develops within the first hours after injury. So whenever a person suddenly got burned with the diya or light or candle, it's a 40% burn situation. The person taken to the hospital in the intensive trauma unit, that is a burn care unit, he or she has been taken. In the first 24 to 48 hours, that phase is considered as F phase. So there is reconstruction of the normal body's normal tissue perfusion, and there is an effort, because when there is severe burn or trauma situation, what will happen? A lot of cells start to burst out. There is excessive amount of water excretion is there. So my body balance, what is called homeostasis, this homeostasis mechanism is being imbalanced. So my first and foremost, my body what they want to do, my body want to reconstruct the body's normal tissue perfusion, make the tissue to be normalized, and so that my homeostasis imbalance may not happen, to protect the homeostasis and to make the body into good balance. So in this phase there is a decrease in the total body energy and urinary nitrogen excretion. Why? Because there is already too much amount of cell breakdown. So this cell breakdown leaded to too much amount of protein breakdown, and when there is too much amount of protein breakdown, this protein lead to, when there is too much amount of protein breakdown, this will excrete in the through the urine in high amount nitrogen. But my body is preventing that. My body is saying no, prevent that, stop that at any cost, so that my body's protein level going low, it may lead to a severe difficult situation or undernourished situation for me. So my first and foremost thing is that there is a decrease in the total body energy and urinary nitrogen excretion. So an early increase in the detected in endocrine hormone. So, and also in this phase we are able to see there is some hormones which is at the high level. There is catecholamine, there is cortisol hormone. Endocrine hormone at the high level we can see. Now these are the first phase, and this is the first body's first defense mechanism against the trauma or injury or sepsis situation. Now in the second phase there is flow phase. So defined as all or nothing reaction. Here basically everything start to become normal and start to become normal. There is high substrate flow should to get the target system essential. This response is necessary for the survival in the short term. And if it is persist for a long time, or if the response is severe, it lead to body damage. But here we need to increase the metabolism, but not too much that may lead to metabolic hazard. So as a result of this long lasting response, adipose tissue, skin and other tissue are destructed. So here we say that not too much of the body tissue destruction, but here we say that in the flow phase we increase the catabolism and anabolism come to a lower level. So here we basically start to balance between anabolism and catabolism, and we start to get a homeostasis mechanism in control. So basically here catabolism happens that provide compensating response to the trauma, and in this phase the metabolic response is directly related to giving too much of energy and protein so that it may protect the tissue. Whichever tissue has been burst out, the repairment of this damaged tissue and the various other organ function which is under the sepsis, they come back to under control. And also oxygen consumption is high, and metabolic rate is among the metabolic rate are also among these responses is being high. So in that way my body start to a homeostatic mechanism. So in the F phase there is initiation, in the flow phase there is already the portion is under control. This is the early metabolic phase, and there is a late anabolic phase. The late anabolic phase where it's the final phase of recovery period, and it is characterized by my body's protein, because already when you have trauma or injury situation, there is too much of protein breakdown, lipid breakdown. It's very common. So generally we have to keep that in mind. There is the late anabolic phase. There is the too much amount of protein and fat breakdown need to be restored. So restoration of body protein or body fat store is being done. Normalization of the positive nitrogen balance is being done after the metabolic response of trauma is stopped. So nitrogen balance to be given to a positive so that the trauma may be stopped. So it may take a few weeks to several months after serious injury. It is not like that after 3 days or 4 days it started. No, it's not like that. It may be like few weeks, after 7 to 10 days or after 15 days it start to happen, or it may be there is so situation where it's the several months after the serious injury, there are several months to be taken. So generally what happened, we say in the ICU patients nowadays, we always say that when a lean and thin people come to your ICU with a severe trauma situation, it is very difficult to handle. So it's better if you have a severe amount of a slight amount of adipose tissue is there. A lean and thin people is very difficult to handle in an ICU situation rather than a patient who have some adipose tissue. So it's better the person who has some adipose tissue, who is a slightly bulky, they are better gainer, they are better achiever in the ICU rather than the lean and thin people. So I may not suggest to become fatty or become obese, no, but I am suggesting to have a normal body weight rather than to be undernourished, because undernourished people is very difficult situation in ICU and increase the hospital stay. Whereas if you are in the normal weight or a slightly overweight, not I am talking about obese, a slightly overweight, like if your ideal body weight is 60 kg and you are 63 or 64 kg, then it's better that your ICU, if you have to go to the ICU, the recovery stages will be better. So that is the thing we can suggest for. Just a second. Hello. আমি একটা ক্লাসে আছি, আমি একটু পরে রিং ব্যাক করছি, হ্যাঁ? Okay. So let's come to this. This is the one we generally provide and this is the one we generally follow. So I may not suggest that to go overweight, but it is better to be tolerated. The achievers are better. Okay, so it may take a few weeks to several months after the serious injury. So see here, F phase is the duration of 24 to 48 hours. Okay, first, just after you have gone with the injury, it is within 24 to 48 hours. It will conserve the blood volume and energy. Repairment start. Here, BMR, temperature, carbon dioxide level, the volume level in the body, lactic acidosis, all are in the decreased position. Hormone which are in the top level, catecholamine, cortisol, aldosterone. Okay, now flow phase. Flow phase, there is one phase which is called catabolic phase, which is 3 to 10 days, where the energy store is mobilized, the recovery and repairment is being started. Here BMR, temperature, carbon dioxide, O2 consumption, everything is in the higher position, and the various hormone like cytokine, insulin, glucagon, cortisol is being high, and insulin resistance situation start to be decreased. And after that, that is a recovery phase, what we call, that is a late anabolic phase, which is happening till 10 to 16 days, what we call several weeks to several months. Here the lost tissue are being replaced with a new tissue. So Here the nitrogen balance become positive, because when there is an injury the nitrogen balance become negative, because all the body protein start to be washed out. So when there is a positive nitrogen balance, physiological response is going to be a positive nitrogen balance when it is the anabolic phase. Here basically those hormones which take place, growth hormone and growth factor, these are basically intrauterine growth factor, these are basically taking place in these hormonal responses. Now, if I talk about the endocrine responses, there comes a hormonal responses which is related to the nervous system, that we call the neuroendocrine responses. Here in the neuroendocrine responses, hypothalamic pituitary adrenal axis release the glucocorticoid hormone. Now, there is sympathetic nervous system as well, which is releasing the catecholamine hormone. So, this glucocorticoid and catecholamine hormone is the first phase. Like in the F phase, we basically have that. An early response of the neuroendocrine system upregulation of the sympathoadrenaline axis. So an early response of the neuroendocrine system upregulation of the sympathoadrenal axis, basically everyone is taking place. Glucocorticoid, catecholamine, these hormone are in the those which are basically the stress hormones. The stress releasing hormones are in the what place? This cause inhibition of glucose uptake by the tissue. So what happened? Glucagon secretion start. Sympathetic activity promote lipids breakdown within the adipose tissue, which is given the energy source for gluconeogenesis. So from the non-carbohydrate compound, glucose start to produce. Gluconeogenesis in the liver is stimulated by glucagon again. So what happened? The glucose start to break down. The liver start to produce the new glucose from the non-carbohydrate compound, and in that way the body start to have a good carbohydrate metabolism process, because the insulin, they are not able to function. Insulin is being resistant during the trauma situation. For that reason the glucagon is being increasing the gluconeogenesis process, and the lipids start to break down. Sympathetic nervous system break down the lipid, and from the lipid also producing the glucose. So in that way this response is going on. So you can see sympathetic nervous system, hypothalamic pituitary axis, various hormone like adrenocorticotropic hormone, thyroid stimulating hormone, growth hormone, follicular stimulating hormone, luteinizing hormone, all these hormone, the inflammation and the immune system like cytokine mediator and various behavioral modification, all these are getting the stress responses in the body after the injury situation. So you can see these are the hormones which basically take place. So you have seen a lot of hormones are there. Some are secreted from hypothalamus, some are secreted from the pituitary, anterior pituitary, posterior pituitary. Some are there autonomic nervous system and renin angiotensin system. So some are from the kidney tubules. So all these hormones are conglomerate with each other and taking a mechanism, so that this mechanism will help them to regulate the body balance and to regulate the homeostatic mechanism in the body. So coming to the hormones, what is the first of all, in first 24 to 48 hours there is the secretion of catecholamine hormone. What they do, they increase the blood glucose level, raise the metabolic rate, mobilize the fatty tissue from the adipose tissue, it start to come down to liver, and there is the stability in the homeostatic stability. Antidiuretic hormone, just within 1 week it start to increase. It promote the reabsorption of water, so that water may not be getting out of the body too much, because it may lead to dehydration situation, which is very much common. Dehydration is very much common in the trauma patient. So basically, and also doing the vasoconstriction, and in that way the water is reabsorbed in the body. Now renin angiotensin, that is also release the conserve the sodium, eliminate potassium, and in that way the blood pressure to be maintained in a good way. Insulin decrease the secretion in first few hours, but after later at the anabolic stage, that is in the recovery period, it increase the release, and in that way it release the glycolysis, glycogenesis, lipogenesis. Glycolysis means glucose breakdown, glycogenesis from glucose to glycogen, lipogenesis, lipids start to break down and produce the new glucose from the gluconeogenesis process, and various pro-inflammatory activity. Growth hormone is secreted in the anabolic phase. It increases the protein synthesis, and ketone body production is being increased at that time. And after, there is no such responses change, but what happened basically, insulin is being, there is two phases. In first few hours we say decrease secretion, but in later anabolic phase increase the release of insulin, But what happened, insulin, whatever may be insulin release, but insulin become resistant to the body. That situation is called insulin resistance situation. So that's why the glucagon is in action, what we see generally. Now coming metabolic changes after the trauma. So after the trauma, the first and foremost metabolic changes happen. The oxygen and energy requirement are increased. Because there is trauma situation, my body is under severe stress, my oxygen requirement is high, my energy requirement is high. So 40% of the total energy body consumption is used for ion pump, the sodium potassium ion pump and transport process. So my body requires a huge amount of energy. So you are not able to believe that a severe high amount of energy need to be given during the ICU, and that's why we need to give the tube feeding along with the peripheral nutrition. Now coming to lipid metabolism. So already we saw that free fatty acid are the primary source of energy, and triglyceride provide the 50 to 80% of the total energy consumed. So that's why I said that it's better to have some amount of adipose tissue in you if you go to ICU. So if anyone have to, like if anyone is suddenly, because we don't know, like in the second moment we can have to shift to the ICU, because there is no such confirmation that you may not have some anything. So it's better to have some amount of adipose tissue in you, because lipid is the one which is providing the 50 to 80% of the energy during the trauma or critical illness situation. So a person who have some amount of adipose tissue in her body, who are slightly overweight, for them it is better to cope up during the trauma situation during the recovery phase. So what happened, basically adrenocorticotropic hormone, cortisol, catecholamine, glucagon, growth hormone, insulin and the sympathetic nervous system activity become decreased, all lead to the lipid breakdown or lipolysis situation. So if the patient is given glucose in a dose more than he can oxidize, that will lead to hepatic steatosis. So it's better that, and also if we give too much amount of carbohydrate, it may lead to hyperglycemia, and this can cause an insulin resistance and lead to severe more diabetic situation. So it's better to go for a lipid sources. Okay, so in this way glucose can be used as a peripheral injured tissues, but generally 50 to 80% of the sources come from the lipid. So the activity of the lipoprotein lipase is reduced in the fat and muscle by the action of increased pro-inflammatory cytokine, that is tumor necrosis factor in trauma and sepsis. So generally we say that is the first phase, F phase. Plasma fatty acid and glycerol level are increased, because here already my body will see that there is trauma situation, lipids start to break down. Lipolysis continue in the flow phase, and when there is increased fatty acid, it inhibits the glycolysis, because glucose body needs the glucose. So he says that stop glucose breakdown. I am there, lipid is there for breaking down and producing the energy. Now when there is increase in the glucagon level and the fatty acid level in the cell is being high, fatty acid synthesis is inhibited. Okay, so but it is in the severe trauma or hemorrhagic shock or sepsis situation, inhibition is not there. So generally the fat plays a very important role here. Now coming to the protein and amino acid metabolism. Generally what happen when there is surgical stress or there is injury situation, what will happen, there is increase in protein catabolism, negative the nitrogen balance and increase the protein turnover. So what happen in metabolic response to trauma, there is protein start to break down. Negative nitrogen balance, protein start to break down. So of course the body getting out too much of protein, so negative nitrogen balance, protein catabolism increase and protein turnover increase. So in that way the urinary nitrogen is increased up to 30 gram per day, which is around 4 to 6 gram per day. It is going up to 30 gram per day, which is too high. So there is total body loss of 1.5% daily. According to this calculation, traumatized individual with no oral nutrition is going to lose 15% of his body mass in 10 days. So amino acid cannot be accepted as long-term fuel. Of course, because always we go for long-term fuel, the lipid and the carbohydrate. Gluconeogenesis is there. From the protein, the glucose is being produced, but generally we say that fat is better for the gluconeogenesis, because protein is very much important for the acute phase protein, albumin, fibrinogen, glycoprotein to be in a contact. So effective elective surgery and minor trauma lead to a decrease in protein synthesis. There is protein degradation. Severe trauma, burn, sepsis, we need increased protein catabolism. So there is already high urinary nitrogen, negative nitrogen balance. For that reason, protein catabolism is very much high in that. which lead to degradation of skeletal muscle. The person become lean and thin, very severe lean muscle mass, and all these lead to the changes in oxygen uptake and heart rate as well. So protein need to be given in a good amount. So increased cortisol level, there is insulin resistance, there is low level of oxygen and acidosis, all lead to protein breakdown. And protein breakdown is something which is very difficult to handle. Net muscle protein recovery can be obtained during the last recovery period with the, and this is only with enough exercise and nutritional support. A good amount of nutritional support and a proper aerobic exercise is very much important. Like a good amount of oxygen support is very much important for the protein to be getting, not to be getting down, proteolysis to be stopped and get the enough repair. Now we are happen to going to have the carbohydrate metabolism. Administration of glucose to the surgical patient during the fasting aim to reduce the protein breakdown and to prevent the loss of muscle mass. So generally daily infusion of 50 gram of glucose increase the fat oxidation and suppress the ketogenesis situation, ketone body formation. So when there is excessive glucose administration, excessive carbon dioxide production will occur. So it may lead to adverse effect in patient with reducing the pulmonary function. So during the fasting, administration of glucose reduce the protein breakdown of gluconeogenesis. But this is not even sufficient. Carbohydrate metabolism is important. Other hormonal and pro-inflammatory factors are effective in protein degradation. Administer the insulin in increased stress, decrease the protein breakdown in the muscle tissue as well. And one of the most important body response to trauma stimulation is giving the good amount of carbohydrate. Carbohydrate at any source, you are giving from a directly glucose, direct administration of glucose. When it is not possible, it may lead to hyperglycemia. So generally we go for gluconeogenesis situation if there is insulin resistance. So whatever may be the source, you have to give good amount of carbohydrate. Okay, glucose can be used by hypoxic tissue and inflammatory cell as well. So it's very important to give a good amount of carbohydrate. So, and along with that, gluconeogenesis is an essential process. So it is driven by the cytokine. The lactate metabolism is also there. So whatever may be the metabolic mechanism, through all the metabolic mechanism, I have to provide the glucose to my body. Insulin resistance is there because insulin control the protein metabolism. Insulin also control the fat metabolism. There is a normal decrease in the normal anabolic effect of insulin, so which may lead to insulin resistance. My body become insulin resistant. So for that reason, we have to go for gluconeogenesis situation where protein and fat act as a source of glucose. So when there is increased insulin effect, it may lead to glucagon, catecholamine, growth hormone, cortisol, and various inflammatory reaction, lead to major stress situation, all lead to increased insulin effect. All this lead to the development of gluconeogenesis situation. Now, in a surgical patient, what are the various metabolisms? Adequate nutrition. Adequate nutrition of the patient who lost the weight will undergo the surgical procedure is very critical. What I said, lean thin people is very difficult to go for surgery. Patients generally die not due to their present disease but because of malnutrition. Today we will come to that. In starvation, glucagon, epinephrine stimulate the glycogenolysis. Glycogen start to break down through the cyclic AMP pathway, where cortisol and glucagon stimulate the gluconeogenesis. From the non-carbohydrate production of glucose. So age, nutrition and diet, anesthesia, operative stress, everyone is affecting the surgical response. So after the operation, generally the utilization of glucose is reduced due to insulin resistance. So then we need triglyceride, free fatty acid to go for the breakdown, and in that way the gluconeogenesis is being produced. Metabolism during the fasting situation. So what happened? A lot of people in the ICU due to severe fasting or severe malnourishment. So that's why we have to give, human require around 25 to 40 kilocalorie per kg per day of carbohydrate, protein and fat. So generally we have to give 300 to 400 gram of carbohydrate, through which 75 to 100 gram goes to liver, 200 to 250 gram goes to muscle, because there is too much amount of carbohydrate lowering effect we can see. Following the first 24 hours of fasting, liver and kidney glycogen store will be depleted. And after you like 1 day of fasting, 2 days of fasting, 3 days of fasting, after 5 days of fasting, there is about protein start to degrade. 75 gram of protein degradation already been there. And after 5th day, there is stress hormone response decreases. Protein degradation lead to 15 to 20 gram per day. And there is lactate is not sufficient, protein degradation, protein start to break down, urinary estrogen level is too high. All this happened due to starvation, due to severe weather calamity. There is flood, there is drought. For all this, there is lead to starvation situation. All may lead to a situation lead to ICU. And proteolysis is reduced to 20 gram per day. Urinary nitrogen stabilized when there is prolonged starvation. My body give up. Organs adapt to ketone body. Kidney utilize glutamate. Adipose store provide up to 40% calorie. And insulin is stimulated, reduced insulin, increased glucagon. Glycogen start to break down. And my body is already give up and already in a going to the coma situation as well. So here the nutrition is a very important part. And there comes the role of a dietitian. The traditional preference is to feed the patient by the enteral route, like through the tube feeding. Enteric organism, if not possible to be done, then we go for the total parenteral nutrition or the parenteral route or through the veins. So the route of feeding may have an impact on the production of cytokine after injury. So thus the use of enteral route may confer an additional advantage. Considerable attention has focused on the nutrient that has attenuated the metabolic response to injury. Nutrient that appear to enhance the immune system. What they include? Arginine, glutamine, nucleic acid. So immune system enhanced with omega-6 fatty acid versus omega-3. Other nutrients act as an antioxidant. What are natural antioxidant? Vitamin A, vitamin C, vitamin E, selenium, zinc. All need to be given. So this enrichment is very essential. So in the critical illness, there is catabolism, increase the energy requirement. There is starvation, there is impaired GI motility, unsuitable nutrition protocol. All may lead to insufficient coverage of energy by enteral nutrition. There is negative protein energy balance under nutrition. Then we go for supplemental parenteral nutrition, which will increase the morbidity, increase the mortality, longer length of stay, longer recovery if we not go for. And if we go for supplemental parenteral nutrition, we generally go for only enteral nutrition because people say that enteral nutrition is the safest route. But when we see that after going to be enteral nutrition alone, there is negative protein energy balance or undernutrition, then we have to go for supplemental parenteral nutrition. Otherwise, you may lead to morbidity, mortality, longer length of stay, and longer recovery. So in a conclusion, we can say that injury produces a series of physiological changes which is mediated by local and systemic agent. So the metabolic response aim to produce the substrate delivery in the injured organ and promote the recovery. So metabolic response is very important, where the neuroendocrine system will play the main important role in the stress response. So next we come that what we say already, that nutrition is very important. So when a person is being admitted to the ICU, what will be the evaluation of the nutritional status and assessment? So generally the major problem related to ICU patient or related to the metabolic response, and due to various metabolic responses and metabolic alteration, the person start to suffer from malnutrition situation, where there is deficiency of energy and other nutrients. There may be excess, but generally in the ICU patient we see that there is deficiency, and due to that a body mass index less than 18.5 kg per meter square. Unintentional weight loss, you have seen, we have asked the patient party that if there is unintentional weight loss, that means the person is not dieting, but there is a weight loss of 3 to 6 months, there is less than more than 10% of weight loss, and a BMI less than 20 kg per meter square, and unintentional weight loss more than 5% on 3 to 6 months, all are the criteria of malnutrition for an ICU patient. So when the person in the malnutrition in the critically ill, we have seen it may lead to surgery. There is immobility, the person may not able to go and like there is no person doesn't have a mobility situation. Bed rest become prolonged, we have to give steroid. There is changes in substrate utilization, too much stress, metabolism high, and poor intake. All are leading to the malnutrition in critically ill patient. All are the results of this. So what are the consequences? Weight loss, weakness, fatigue, impaired ventilatory drive, depression, poor wound healing, impaired immune function, all over lead to death. So in the ICU patient, lead to death situation. So it's very important to give a proper nutritional substrate so that the protein and energy meetup happen. The organ which is being affected, the affected organ will get protected and reduce the breakdown, to provide the nutrient needed for repair and healing of wound and injury, maintain the gut barrier function so that my gut will able to provide a good amount of energy and protein a good amount of support, and modulate the stress response and improve the outcome, improve the wound healing situation. So generally nutritional assessment is very important. So nutritional marker like what is the level of albumin, hemoglobin, urea, creatinine and glucose in the blood is very important to be getting out through the blood test. And of course to know the BMI. If the BMI is below 18.5, that is moderate malnutrition. If it is below 16, it is severe. If it is below 13 and below 11 in male and female respectively, it is a lethal situation. The person is not able to get recovery. The person is already in a death situation. So how we are able to check for malnutrition? If there is illness, if the person is eating poorly for lifetime, like whatever for last 3 to 6 months, there is any tooth loss or mouth pain, the person is not able to cope up with the two-way meal, reduce the social contact, the person is taking multiple medicine, there may be a medicinal effects as well, involuntary weight loss or gain, assistance in the self-care, and elders who are above 80 years, they are the major criteria thing for the malnutrition. So in the malnutrition, we can see the body protein store is being reduced, metabolism is being impaired, and micronutrient store is imbalanced. Lead to weakness. Weakness lead to longer time in the ventilation. Inadequate immune function lead to slower rehabilitation. Wound healing become poor, so lead to infection. All this lead to increase the mortality situation, increase the hospital stay. And last but not the least, the cost of the stay is too high. That may lead to the development of course, the person is economically broken down, and that they are not able to cope up with. So critical illness reduce the intake and nutrient loss, lead to deficiency, reduce the muscle mass, change in body composition. So loss of the recoveries of tissue and functional capacity. And in the critical illness, they require a good amount of energy, but when they are not able to utilize it, so it may to nutrition and but of course lead to functional capacity is being lost. All this situation, critical illness lead to malnutrition, malnutrition lead to critical illness. So critical illness and malnutrition is a vicious cycle. If we are not able to break down with good intake and good nutrient with a good energy, then we are not able to cope up with. So it's very important to break this vicious cycle to make the people properly cope up in the critical situation. So malnutrition in the ICU patient basically increase the infection rate, increase the complication, increase the hospital stay, and treatment cost is severely going to be 2 to 3 times more. So it need to be reduced. So last but not the least, this is my last slide to be presented, that when a person is going to have a malnutrition, this when the person is going to have a going to admit it in the hospital and the person is not conscious, so how we are able to take that? First of all, we take the BMI from the last prescription. If the BMI level is more than 20, then the score is 0. If the BMI level is between 18.5 to 20, the score is 1. If the BMI level is less than 18.5, then the score is 2. Okay. Now, if the person weight loss, unintentional weight loss, the person is not dieting, unintentional weight loss in the last 3 to 6 months. If it is below 5%, 0. If it is between 5 to 10% unexplained weight loss in 3 to 6 months, score is 1. If it is more than 10%, then the score is 2. And if the patient is acutely ill and is likely to be no nutritional intake for more than 5 days, the person is not taking anything, the person is severe starvation, the score is 2. Add all the score. If your score is 0, like nothing is being there, so you are in a routine critical care hospital, you can come weekly, or home care you have been monthly, there is no such problem. Now if your score is 1, you are at a medium risk, you need some observation, you have to take the dietary intake, we have to screening, and also you have to be in a hospital, but in a general way. Now if your score is more than 2 or more than 2, that is in a high risk. High risk, you need a treatment. The team of dietitian, nutritionist, and of course surgeon, doctor, everything is needed, and the person is admitted already in the ICU. So must tool need to be taken, and the score 2 is 2 or more than 2 is very important when a person is admitted in the ICU. And that after the ICU administration, they are being done, and it is being done. So it is a MST tool. MST tool generally we do not use, but somehow in the various West Bengal hospitals we generally use that. So that's why I have given here. Same thing happens, but it is not at all universally accepted. So I may not suggest that to be given. I have just given that for your reference. But malnutrition universal screening tool or must tool is the one we generally prescribe for all over the world, and this is the what we universally accept the patient to be admitted in a ICU or not to be taken, and to evaluate the nutritional screening for that. So that's all for today. Thank you so much everyone for attending the session. If you have any question regarding today's session, please feel free to ask. One by one, you can raise your hand or you can ask your questions.
Hello.
Yes, please.
Good evening, ma'am.
হ্যাঁ, good evening.
Myself শিশির বরণ সরকার।
Yes,
ম্যাম,
please.
আমি বাংলায় বলছি। ম্যাম,
হ্যাঁ,
আমি
বলুন।
জানতে চাইছিলাম যে কত দ্রুত সম্ভব ধরুন ক্রিটিক্যালি ইল পেশেন্ট, তার ক্ষেত্রে ধরুন প্রাথমিক লেভেলে আমরা হয়তো ফিডিং চালু করতে পারছি না, অ্যাকুইট প্যানক্রিয়াটিস বা অন্য কোনো ক্ষেত্রে, তো কত দ্রুততার সাথে বা কত মিনিমাম যে 24 আওয়ার বা 48 আওয়ার্সের মধ্যে তার ফিডিং চালু করা উচিত আর কি, উইদাউট মানে আমরা যে ডিএনএস বা 5DD এগুলো ছাড়াও তার এন্টারাল অথবা প্যারেন্টাল নিউট্রিশন চালু করা উচিত?
Within 24 hours we have to start their enteral feeding. Within 24 hours, whatever may be the situation, generally say within 8 to 12 hours we have to start, other than the saline and all. But if there is severe trauma or burn situation, I have seen a lot of burn situation in the more than 45% 50% burn. So generally there we have to first go with the recovery of fluid and electrolyte, then we should start with the enteral feeding within 24 hours.
মানে আমরা যত তাড়াতাড়ি সম্ভব তাকে ফিডিংটা স্টার্ট করে দিতে হবে,
ফিডিং স্টার্ট করতে
তাহলে
হবে,
তার মাস।
otherwise there is a lead like they may lead to death situation.
ঠিক, ওকে, থ্যাংক ইউ ম্যাম।
Okay, any other questions from your end, please? Have you understood my class today? Have you liked today's class? There is so much of information in one class, so please go through that class. It's very difficult to complete.
হ্যাঁ ম্যাম, খুব ভালো বুঝতে পেরেছি ক্লাস, কোনো অসুবিধা হয়নি, খুব সুন্দর বুঝতে পেরেছি, খুব ভালো এক্সপ্লেন, আমাদের খুব ঠিক, আমার খুব ভালো লেগেছে। কিন্তু মানে এত ইনফরমেশন এরপর যদি পড়তে না একটু না পড়ি মানে একটু গন্ডগোল হয়ে যেতে পারে। তো আমরা মেটেরিয়ালটা কি আবার রিকভারি করতে পারবো?
একদমই, আমি মেটেরিয়াল এক্ষুনি গ্রুপে পাঠাচ্ছি বেসিক্যালি, এবং এক্ষুনি গ্রুপে পাঠানোর সঙ্গে সঙ্গে আমাদের এই যে ক্লাস রেকর্ডটা সেটা উইদিন 24 আওয়ার্স এর মধ্যে ক্লাস রেকর্ড পাঠিয়ে দেওয়া হবে।
আচ্ছা, থ্যাংক ইউ ম্যাম, ঠিক আছে।
হ্যাঁ অঙ্কিতা বলো। ইয়েস অঙ্কিতা।
Hello ma'am, first is the video is very effective ma'am, we learn lots of things from you, the class is very effective, and every day I am also in onco nutrition, so I learn lots of things from you. And my question is, if the patient has burn, 3rd degree burn or 2nd degree burn, they also admit in ICU. If the patient have any diabetic history, and I have to give their parental nutrition, internal nutrition to them, but they are very much rich source of carbohydrate as well as fats. So in this case, what kind of precautions we have to take?
First of all, our first and foremost time there is to we have to give the insulin then and then, and we have to give the dextrose solution, because there is no such other options we are available, because we have to give internal carbohydrate, intravenously carbohydrate. But generally there we source, there majorly triglyceride source we focus on, and the carbohydrate source we focus on less, because second source is carbohydrate, first source is fat here, and third source is protein we are giving not for the energy, protein we are giving for the repairment. And along with that we start to give the insulin injection, whatever may be the situation, because we have to control the blood sugar level, so there may be no such hyperglycemia.
Okay,
so that thing we can follow,
that techniques we can use.
Yes, that technique we can use.
Thank you so much ma'am.
Okay, thank you. So I hope I am able to answer everyone's question. Thank you so much for attending the session. We will meet you again on 8 because after
ম্যাম আরেকটা প্রশ্ন করতে পারি ম্যাম?
yes
হ্যালো
please.
ম্যাম, বলছিলাম যে প্রাথমিক অবস্থায় আমি ধরুন তার 19 মতো রয়েছে বা 18.5 বিএমআই রয়েছে, তো সেক্ষেত্রে আমি প্রথম দিন তার যে মিলটা দেবে আফটার 24 আওয়ার্স, সেক্ষেত্রে প্রোটিন, কার্বস এবং ফ্যাটস এর যে রেশিও সেটা কেমন দেওয়া উচিত, যদিও এটা ডিপেন্ড করে বিভিন্ন
Depending on the completely depending on the situation,
যদি
patient
যদি
recovery.
তার কিডনি যদি ঠিকঠাক থাকে, ক্রিয়েটিনিন লেভেল নরমাল যদি থাকে, তাহলে
Kidney ঠিকঠাক থাকলেও there is a situation the patient may suffering from refeeding syndrome. Suddenly the patient is starved, already the patient is not taking anything, and suddenly you are giving too much of food, the patient is not able to metabolize. So we have to start from very lower, and then we have to go higher and higher and higher. So we have to
মানে
start
ভেরি লো বলতে
very low,
মানে
like around 1800 or 1900 kilocalorie. Then
ওকে
we
ওকে
should go
ওকে
like 220, 200, 2400 kilocalorie, then 2600 kilocalorie, one by step. But if you directly grip the 3000
সেক্ষেত্রে
kilocalorie, it is not possible to cope up.
সেক্ষেত্রে প্রোটিন কতটা দিয়ে শুরু করা যেতে পারে, কত
Protein
গ্রাম
we basically go for
বডি
1.2
ওয়েট?
gram per kg body weight. Ideal body
ওকে
weight. Per kg ideal body weight. 1.2 gram per kg ideal body weight if there is no such kidney problem. If the kidney problem is there,
ওকে,
we start with 0.8 gram per kg ideal body weight.
ঠিক আছে, থ্যাংক ইউ ম্যাম।
Okay. Okay, thank you so much. Tomorrow already you will get your notification from Rhea ma'am today by 9 p.m. And I am sharing my PPT as well. So we will meet you again on after Shuddhita ma'am class on 8. There will be an hour ceremony and something about FSTN. Thank you so much everyone. Till then, good night. So we will let you know about the other classes. Tomorrow in the Rhea ma'am class, please join the class. And if you have any question, please ask to ma'am. Ma'am will also coordinate with like that. Thank you so much everyone. Good night.
থ্যাংক ইউ ম্যাম।
Thank you so much, ma'am.
থ্যাংক ইউ ম্যাম।